everyone. Today I am giving you explanation on the topic blindness. This one is the blindness part 11. Here which I will explain you about the corneal blindness. So let's move to its description. Corneal blindness. A significant number of cases of the visual impairment and the gross degree of loss of the vision occurs due to the disease of the cornea. Okay. So significant number of the cases are due to the corneal blindness, which occurs due to the different diseases of the cornea. It is reported that there is an addition of 25,000 to 30,000 corneal blindness cases every year in the country. Okay, so this is a big weightage which is given to the corneal blindness, which is 25,000 to 30,000 cases every year. They are increasing because of the corneal blindness. Major causes of blindness are the corneal ulcers, which are due to the trachoma infection and the ocular injuries. Corneal blindness is one of the outstanding problems in the field of preventive, and the community of ophthalmology is a great challenge to the medical profession in general and the ophthalmologist in particular. Okay, so it is a very outstanding problem and it is a major challenge in case of the ophthalmologic field as well as in the journal. Okay, because if the person becomes the corneal blind, then he or she is not be able to do the daily activities, becomes the totally blind. Okay, if these problems which are related to the cornea are treatable at the time to time, then proper intervention should be done, proper treatment should be done, then the person can prevent from the corneal blindness, otherwise the person become corneal blind. Okay, second option we have, which is the surgery. Transplantation of the cornea is done, but the transplantation of the cornea needs a lot of care as well as the hygiene which is done by the patient. If it is not possible for a patient to do proper care of the transplanted cornea, then again it will lead to the corneal blindness, and it is a major surgery as well as the painful and the caring surgery. So if you are noticing here that this one is the normal cornea. Okay, transparency is maintained, it is lustrous cornea, or we can say it is the healthy cornea. But if you are seeing in this case, the upper layer becomes the opaque. Okay, so in case of healthy cornea, the light passes from the cornea and then it will move to the lens, passes to the different parts of the eye, then touches the retina. As a result, it will form a proper image and the person is able to see. But in case of this, the light doesn't get passed on through the cornea because the cornea is opaque, so it is not possible for that person to see an image. Okay, so let's move to the next. The challenge can be faced boldly by combined efforts of the public and the government, especially the education department, school children, general medical practitioners and the ophthalmologist. Okay, so the challenge is for the country and this one is the challenge for each and every person, which we can face or which we can cure with the help of proper management or with the help of proper efforts which are done by the government, especially the education department, because the life of a children begins at the education department through the school children, or if any general medical practitioner find out any kind of corneal disease or unhealthy cornea, then can refer the person to an ophthalmologist, so that proper treatment should be done time to time and we can prevent the corneal blindness. Let's move to the next objective. Objective regarding the corneal blindness which is taken under the Vision 2020 in India is to reduce the prevalence of the preventable as well as the curable blindness. Okay, we have to reduce the preventable blindness as well as the curable blindness of the cornea. Strategies. Two types of strategies are there. First one is the general strategies and the second one is the disease specific strategies. General strategies are general strategies and the disease specific strategies consist different things. First one is the eye infections, second one is the eye injuries, third one trachoma blindness, fourth one prevention of xerophthalmia, and fifth one are the preventive measures. So let's see what are the general strategies. Identification of infants at the risk. The newborn babies, first of all identify the newborn babies who are at the risk, who have the chances of any corneal diseases or have the unhealthy cornea, refer to the specialist. Identification of preschool children at door-to-door survey. Door-to-door survey should be done so that the children should be identified because the children are the base. Okay. Identification of school children through the school health services. School health services will identify those children who have the unhealthy cornea and have the any problem regarding the eyes, to ensure the proper supply of essential drugs which are required for the public health care like vitamin A supplements and the antibiotics. Okay. Identification of senior citizens with the post cataract surgery and the bullous keratopathy. Now the corneal blindness will also come after the post cataract surgery. So after doing the cataract surgery, proper follow-up is very important. Okay, so the treatment should be done at the time to time, and then it will get treatable. And the bullous keratopathy, okay, if the corneal transplantation is done, then bullous keratopathy kind of surgeries can be done. So proper follow-up is very important for each and every person. Okay, so corneal blindness is again the risk for the newborns, children, as well as at the adult age, as well as the senior citizens. So it is a risk factor for a person at any stage. Next one, eye infections. Now let's see what is the role of eye infection. Eye infection, including the ophthalmia neonatorum, ocular prophylaxis at the birth with the broad spectrum antibiotics is very important. Okay, so proper prophylaxis is taken at the birth with the broad spectrum antibiotics. Health education and the improvement in the personal hygiene will reduce the incidence of conjunctivitis. Health education should be provided to each and every person, and the improvement of personal hygiene, how we have to maintain the hygiene, which will reduce the incidence of conjunctivitis. Okay, conjunctivitis is the basically inflammation of the conjunctiva, but if it reaches to the end stage, then it will lead to the different kind of eye infections and leads to the corneal blindness. Corneal ulcer and the other eye infection will prevent the corneal blindness. Okay, and the early treatment of the eye infection will prevent the corneal blindness. So in each and every stage, when cornea gets suffer from any kind of disease, one should have to move to the ophthalmologist. Next one, eye injuries. Education of the people regarding the avoidance of ocular trauma like the cracker blast, industrial accidents, road accidents, and the other trauma, thereby reducing the irreversible corneal blindness. Okay, so proper education should be given to the patients by generating the awareness that how they have to take the first aid and move to the ophthalmologist immediately in case of trauma like cracker blast, industrial accidents, road accidents, and the other trauma also, which so that we can reduce the irreversible corneal blindness. Ocular trauma cases should be immediately referred to the specialist for the effective management. Facilities for the administrating general anesthesia for the ocular trauma patients at the secondary level. Okay, so ocular trauma cases are always treated at the emergency level or the casualty level by the management, and facilities should be available in the hospitals like the general anesthetist should be available for treating the emergency cases of the ocular trauma. Next one, trachoma blindness. In India, the corneal blindness due to trachoma is on the decline when compared with the previous figure reports, but again the prevention is very important so that it will again not come. Prevention of xerophthalmia. Prevention of xerophthalmia make a strong dent in the number of corneal blinds. Okay, the three major known intervention strategies for the prevention and the control of vitamin A deficiency. Vitamin A deficiency we have to control, and then we will prevent the xerophthalmia. Next one is the protective measures. Now what kind of protective measures should be taken? Protective measure for the eye of the industrial worker and the agriculturist should include the use of goggles. Protective measures should be taken for those persons who are agriculturists, who are the workers, who are workers at the construction site, welders, doing pesticide spray in case of field of agriculture. So according to their different kind of occupation, different type of protective measures should be taken by the persons so that they will save their eyes and prevent the corneal blindness. This was the end. Thanks for your patience listening.